So, how to treat the thyroid. I've already covered thyroid testing. If you missed that, have a look at the video before. Conventional treatment is looking at levothyroxine and basically replacing that free thyroxine or free T4 with levothyroxine. Now, this is synthetic, but it is body identical. It has the same chemical structure as the levothyroxine or the thyroxine your thyroid is producing. So that's standardized treatment, and it does work well for a lot of people. There are other treatments involved that are not conventional and are deemed unlicensed, which means it's not common practice, it's not illegal. And your doctor can look at this if you have a good reason for going on it, like you're not responding well to the levothyroxine. So this can be using some T3 hormone. This isn't, like I said, this isn't common practice, and someone would need a good reason to do this. Now, the current guidelines say that this is not effective, but tell my patients that who are on T3 and have had amazing results with it. And I think especially if you do some gene testing and you find you don't convert T4 to T3, this could be very useful. There are supplements as well that you can take that have substances that can help activate that enzyme better. And that is sometimes something I recommend to patients first and see how they get on with that. T3 is very short acting in the system, so you often have to take it maybe twice a day. As with all thyroid patients, I keep an eye on their levels. I wouldn't want someone to have a crazy high T3 and a low T4. But yeah, that's something that could be made available if there was enough evidence to show that the person would benefit from it. There are other types of thyroid medication, and these aren't things I use commonly. But, I will always consider things based on the person in front of me and what they've tried previously and how they're feeling, what else is going on for them. So sometimes I can compound a different dose of T4 or T3 or a combo of the two. And some people choose to use animal thyroid, natural desiccated thyroid, which essentially is thyroid gland from it's normally bovine or porcine. And this isn't my favorite thing to use. And that's just because I don't really see consistent levels on it. But I often see patients coming to me on it already, who've been on it for a long time, and it would be very disruptive to change it. Or, people just aren't getting on with other thyroid medication and they want to try something different. It's very important for me to listen to the person in front of me and be open-minded. Of course, I don't want to cause harm, but, if, say, somebody really wanted to try this because of bad effects on other medication, I would consider it for 2 to 3 months, recheck their levels, see how they felt, see them again after 2 to 3 months, keep a very close eye on what's going on with things. Now, supplements can be useful. You see, a lot of people don't have a crazy high TSH or a very low T4, T3, but maybe it's just a bit suboptimal. And perhaps then supplements could be of some benefit. I don't like putting people on medication who don't need it, and I don't like treating suboptimal thyroids with medication necessarily. So I would look at thyroid support, like, NutriAdvance do one, Do You do one. These have blended supplements that can help support the thyroid with ashwagandha, selenium, zinc, iodine, some B vitamins, and this can be very supportive for the thyroid. So again, I'd probably put someone on that for 3 months and then recheck their thyroid function. This is for people who've got normal thyroid, but not quite as good as it could be. With thyroid antibodies, because of the risk of it then going on to become a problem in later life, which might not happen tomorrow, maybe in 5 years, 10 years, I would ideally like to see those antibodies coming down. And your conventional doctor will tell you that's not possible. But it can be with good anti-inflammatory supplements, a good anti-inflammatory diet, and also, what was I going to say? I forgot. Gluten. Reducing gluten in your diet really has a benefit on antibodies because that can be quite inflammatory to the body. Sometimes dairy for some people. So the sort of supplements I'm talking about, things like a good omega-3, which is anti-inflammatory, things like alpha-lipoic acid. Vitamin D is very good for the thyroid and reducing antibodies. And then making sure someone has optimum levels of these things. So that's just a little bit about my approach to thyroid. And of course, everything's interlinked. So if thyroid's not working well, is it due to high or low cortisol? Is it due to an issue with your female or male hormones if you're having an issue as a man? Is it related to gut health? That's a biggie. And what's going on with your insulin? So in an ideal world, I'd like to look at all those things all together and then make a plan. So I hope that's helpful to you, a little bit on how I look at the thyroid, and let me know if you've got any questions.